You're live.
Hi everyone, this is Suzette here with Johnston Health. Today we're going live with Latoria Moore, an oncology nurse practitioner here at Johnston Health. We'll give everyone a few minutes to join and then we'll get started. Here we go.
Yes, how are you today,
I'm
Suzette?
good. How are you doing?
Doing well.
Is your day going well?
Oh, yeah, it's been an awesome day. It has,
You've
actually.
seen a lot of patients?
Not a lot today, but they all showed up, which is great.
Good.
Yes.
That's good.
Yeah. Most of them have been vaccinated, which is great.
Wonderful.
Yes,
Wonderful.
yes. It's hard to find one who hadn't, which is great.
Yeah. All right, it looks like a few people have joined us, so we'll get started. Good afternoon, everyone. Welcome to our Facebook Live event. Today, I am thrilled to be joined by one of Johnston Health's finest, Latoria Moore. Latoria is a nurse practitioner with Johnston Health's Cancer Services team, and she works directly with patients undergoing cancer treatment.
Yes.
Latoria, tell us a little bit about yourself. How did you choose oncology?
I chose oncology. I guess it kind of chose me. So I was in undergrad, we were graduating, but my best friend at the time, her mom was kind of seeking a cancer diagnosis, really, or 2 years of just kind of feeling ill. And so finally, when she was diagnosed, she was stage 4 pancreatic cancer, and she was given about 4 months to live. And she only lived about 1 month, so she was not able to see us graduate. A very noble woman. She was in the Vietnam War, and it just really broke my heart at the time. So I said, well, what can I do? What can I do as a person, kind of dedicate my life to oncology? So really, it chose me, and I enjoy it because we give people hope in some of the most insecure and just kind of uncertain times of their lives, and we're able to make a difference.
Well, tell me about your team here at Johnston Health. How would you describe our team? Who makes
Oh,
up
the
the team?
team. They're fabulous. Everyone from our financial counselors to our social worker, our registered dietitian. We have a slew of nurses who are just awesome. They're all certified in oncology and hematology care. We have two doctors, Dr. Anderson, Dr. Russell Anderson, and then Dr. Pam McCamanini, who work in Clayton and Smithfield. We also have our volunteers, of course, and I'm the nurse practitioner, of course. But they're all excellent, very knowledgeable about cancer, compassionate. That's their passion. They mostly have only done oncology. So it's all of our life work.
So expert care and close to home.
Expert
We have
care.
clinics in Smithfield and Clayton.
That's right.
And it's good to note that the radiation oncology clinic is right down the hall or across the hall from our medical oncology.
Exactly.
So very close and convenient. Parking is close by. You don't have to worry about traffic or finding a place to park in a parking deck.
That's
so
right,
those of you who
Suzette.
have just joined us, we're speaking with Latoria Moore. She is one of our nurse practitioners here at Johnston Health. Cancer can be a very intimidating topic,
Yes.
really kind of heavy, but there are things that we can do to reduce our likelihood of getting cancer. What are some of those preventive things that we can do?
I'm happy you asked me that, Suzette. I'm all about prevention. Obesity and excess body weight are, linked to an increased risk of about 13 types of cancer. So there's a lot we can do to reduce that risk. In general, the American Cancer Society recommends about 150 to 300 minutes of moderate intensity activity every week, and of that, about 75 to 100 minutes of vigorous intensity activity. Dieting is important, so a diet low in red meats and processed meats, mostly focusing on vegetables, fruits, and lean meats, limiting carbs and sweets. Additionally, we can reduce our risk by using SPF 30 when we're out in the sun. For women and men, they can be vaccinated against HPV, which is the virus that causes cervical cancer, and 5 other types of cancers. So that is recommended at age 9 to 12 and all the way up to age 26 for both men and women. Additionally, we can limit our alcohol use. So that's for women would be 1 alcoholic beverage a day, and for men, no more than 2. Lastly, we can avoid tobacco products. So that would include e-cigarettes, chewing tobacco, and cigarettes in general. And just screening, just catching it early. So the prostate cancer screening, colon, breast, and lung cancer if you're a smoker.
So that's all good advice. So it all has to do with diet, exercise, and getting those screenings,
Exactly.
timely screenings.
That's right.
So what about what are some of the steps in identifying the treatment of cancer and making those care decisions?
Okay. In general, of course, it depends on what type, but we always start with a screening, as you know, so that's very important, catching it early. And then a diagnostics. Either that could be a biopsy usually, or even a imaging study. And after we have a diagnosis, that guides our treatment. That treatment can involve either chemotherapy, radiation, surgery, can also involve non-chemotherapy agents that we have, newer biologic treatments that we have available. And so that treatment can last anywhere from 3 to 6 months, really depending on the type, the stage, and your response to treatment.
Okay, that's all good information. Do you have any tips or advice for patients and families who are going through a cancer diagnosis or treatment?
I guess that is very personalized, but in general, just being an advocate for that family member, taking notes, asking questions, effectively communicating with the care team. You can also provide transportation for picking up medications, rehab appointments, and any type of imaging or follow-up appointments. Additionally, we would recommend that you provide nutritious meals to them, helping to prepare meals that are high in protein and high fat content. Um, Lastly, helping them to prepare advance directives, which would be like a living will, healthcare power of attorney, having that all available. Emotional support is important. Just being there to listen, to kind of reinforce feelings and emotions. Also to just provide respite care to the family. If you have younger children that need to be looked after, helping to provide care for them and pets as well.
We have some very valuable resources over at our clinics. We have spiritual care chaplains. We have a navigator who
That's
helps,
right.
and
Social worker.
social worker.
There's she provides a lot of access for us to cancer support groups. So she's awesome. So anything that we need, she can figure it out.
And our Johnston Health Foundation has the Angel Fund, and patients who qualify who need assistance with some of those very important things. For example, transportation.
Yes.
That's can be a very big obstacle if you can't
Oh,
get to
my
your
goodness.
radiation or medical oncology treatments. I know you've seen that
Exactly.
firsthand.
Oh, yes. So we help patients get charity care applications if they don't have insurance, or if there's any patient assistance programs. Our financial counselors are just wonderful in helping with that. So it's really not one patient that we would turn away at all.
And
to
I've
that
always
counselor.
enjoyed your team. They really put a big emphasis on giving patients a hug as they get there and as they leave. I'm not sure you're able to do that now with COVID.
I
But
know. We've all missed that for
yeah.
certain.
But someday we'll get back
That's
to that.
right.
As we've been talking, we've received a few questions from our viewers. The first one is, can I get the COVID vaccine if I'm undergoing cancer treatment?
Yes, we recommend that all of our patients get vaccinated against COVID-19. The exception would be if you've just underwent like a stem cell transplant. Other than that, we would recommend all of our patients get vaccinated.
Yes, very important. Which types of cancer are genetic versus environmental?
So there's a variety of inherited cancer syndromes. Just to name a few, we have Lou Fermini syndrome, any breast and ovarian cancer syndromes. There's a variety. So in general, we would screen anyone under age 50 who has gotten a cancer diagnosis. Anyone under 50 would be screened for any type of inherited cancer syndromes. And those cancer syndromes can predispose you or increase your risk for a variety of cancers like melanoma, breast, pancreatic, ovarian. So in general, there are a few.
That's good information. We have another question here. Can I volunteer in Johnston Health's oncology department? And if so, what type of work do they do?
Oh, our volunteers provide an invaluable service for us. They comfort our patients. They give them nutrition, also blankets. They transport our laboratory specimens. They're very integral to our practice. So generally, you can volunteer. We're definitely recruiting and appreciative by going online and just searching UNC Health volunteers. And you can specialize by asking the volunteer service coordinator specifically about volunteering with hematology and oncology.
That's good advice. I know that those volunteers are hardworking. I see them.
Oh, yes.
Running back and forth, so I know that they're very important to your
Very much
to your
so.
care team. For
That's
sure.
right. Okay.
Do we have any other questions? Is there anything else you would like to share before we sign off?
I'm very happy to be here in Johnston Hill. I've had the pleasure of both living here and working here and serving the community, so I'm happy to be here.
We're glad to have you with us.
Thank you.
Thank you so much for coming today.
Thank you, Suzette.
Oh, we do have another question.
Okay.
Are there more natural, holistic treatment options available?
Of course, there are several, but there are not any that we know of that have been studied to both treat or prevent cancer in general. So we don't use any holistic treatments up front. We definitely use any evidence-based treatments that we have. But of course, we welcome any complementary alternative medicine in the supportive care setting.
And I also wanted to remind everyone that we do have clinical trials.
Yes.
It's something that we like to offer to patients if they qualify.
That's right. We screen all of our patients for clinical trials. We have the unique ability to have access to both Duke University Medical Center and UNC Rex Healthcare. So we will screen, there's a few trials that we have at the clinic itself, and then if not, we'll kind of refer to both UNC and Duke.
So we have the best of both worlds.
Best of both worlds here in Johnston County.
World-class care right here in Johnston County.
That's right.
Thank you for sharing your expertise on cancer, and it's such an important topic for our community. I know I learned a lot, and I hope all of our viewers did too.
Yes.
If you enjoyed this conversation, please like and share this video with your friends. If you submitted a question that hasn't been answered, please review and follow up with us in the comments or via direct message, or keep an eye out for our follow-up blog on this talk with Latoria. We'll be hosting more Facebook Live events like these again soon, so make sure you subscribe to Facebook Live notifications so that you can join us again next time. Have a great day, everyone.